Hello everyone, welcome to my channel. I am an international nurse who is helping all the nurses out there to pass their NCLEX exam. Today we will cover the topic of hemodialysis and I will try to cover everything that you need to know about your exam. So what is happening here is when the kidneys are not able to function properly, it means the waste is getting accumulated in our body. To remove all of that waste, we do hemodialysis. It is actually the process of cleansing the client bloods. It is a treatment to filter waste and water from your blood. It also helps to control blood pressure and balances all the important minerals such as potassium, sodium, and calcium in your blood. Here, solutes and water moved across the semi-permeable membrane from the blood to the dialysate with the net effect of lowering their concentration in the blood. So to do hemodialysis, we create fistula in between an artery and a vein, which is called arteriovenous fistula. And it should be placed at least 3 months before the need to initiate hemodialysis, and the maturation may take around 6 weeks to months. I will show you the pictures for forearm AVF. The upper arm AVF looks like this, and there is a connection between the vein and artery here on this. So there are two important things that you need to know about fistula. First is bruit, the second one is thrill. Bruit is a swishing sound that a nurse needs to auscultate, and thrill is a vibration that a nurse needs to palpate. To make sure fistula is working properly, auscultation of a bruit and palpation of a thrill should be present. The next one is arteriovenous graft. This is a form of vascular access which is created by inserting a synthetic tube to connect a vein to an artery. I'll show you the picture here. So you can see the one side is connected to the artery, the another side is connected to the vein. This is made up of a synthetic material or artificial material. However, these are more likely to get infected as compared to arteriovenous fistula, and they have more capacity to be clotted. Clots can be formed easily because this is made up of a man-made material, and as usual 2 to 4 weeks is usually necessary to allow graft to heal. Fistula takes around 6 weeks to months. So in case of emergency, we can use femoral vein or jugular vein to do hemodialysis. Preferable is jugular vein because the risk of infection is less. I'll show you the pictures of femoral vein, and here is the jugular vein. So what is the reason to make a fistula? Why we have to make it? Why can't we use only one vein to do the hemodialysis? We cannot because vein does not have enough capacity to carry high volume of blood. Or we can say why we can't use an artery. We cannot because the risk of bleeding will be more in an artery. That's why we make a connection between an artery and a vein to do the hemodialysis. Nobody is going to ask you this question in NCLEX. This is just for your understanding that why we make fistula, why we make a connection between an artery and a vein. It is created surgically by anastomosis of large artery and a vein in the arm, and I have explained it why we cannot use artery and vein alone. Okay, interventions. These are the most important NCLEX tips that you need to remember before doing hemodialysis or even before creating the fistula. First one is always use non-dominant hand to create fistula. Second one is avoid getting this shunt or fistula wet. Third, teach the client that shunt extremity should not be used for BP monitoring. You cannot take blood pressure from the arm where we are doing the hemodialysis. You cannot do it. Teach the client shunt extremity should not be used for drawing the blood. blood should not be drawn from this arm. Teach the client the shunt extremity should not be used for placing IV lines. As the nurses, we need to remember we are not taking blood pressure, we are not drawing any blood, or we are not placing any IV lines on this arm. And the last thing is always notify the physician immediately if signs of clotting, hemorrhage, or infection occurs. Okay, so before beginning the hemodialysis treatment, a nurse should need to complete an assessment that includes fluid status. We can check the fluid status by monitoring the client's weight, the blood pressure. If there is any peripheral edema, we need to check the lung and heart sounds. We need to see the condition of a vascular access, patient's temperature, and general skin condition. I will show you here. So make sure to monitor the vital signs for the patient. Check the patient's weight before, during, and after dialysis, and monitor vital signs before, during, and after dialysis as well. 14 to 16 gauge large bore needle is used and is inserted into the fistula or graft to obtain vascular access. And there are two lumens in the machine. One is red lumen, which is used to draw the blood. The another one is blue lumen that you can see here, that is used to insert the blood. Okay, take a look at this picture. We are using this red lumen to draw the blood from the body, and the blood is inserted into these tubes. And here we are adding heparin. It is added because it will help to reduce the risk of clotting. Here, heparin is added to the blood as it flows into the dialyzer because anytime blood contacts a foreign substance, it has a tendency to clot. So from here, blood goes in this dialyzer to get filtered, and with this blue tube, the blood is getting inserted back into the body. So the blood that we are inserting with this blue tube is filtered blood, and it is going back into the body. The heparin was added before, and if needed, we will give protamine sulfate to the patient to neutralize the effect of heparin. So with this lead lumen, the blood came out. We added the heparin to reduce the risk of clotting. Then it goes to this dialyzer machine to get filtered. Then with the help of this blue tube, the blood is going back into the body. And if needed, we will give protamine sulfate to the patient. At the end, dialysis is terminated by flushing the dialyzer with the saline solution. The another thing that you need to know in hemodialysis is we need to hold the antihypertensive drugs. I will make a new lecture on antihypertensive medications. For now, you need to remember all antihypertensive drugs are needed to be withhold. Mainly we do beta blockers, but if the client have others going on, then we need to hold that too. So hold antihypertensive drugs as it will result in hypotension. How it will result in hypotension? Because we are withdrawing the blood from the body. All the blood is coming out. The client is, if the client is already taking antihypertensive drugs, then the client's gonna go to hypotensive shock. The another thing that you need to remember is sometimes we have to withhold the digoxin too, because when the blood is coming out from the body, potassium is also coming out. And if the client is on digoxin, the client can have a digoxin toxicity. So make sure to remember digoxin is needed to be held if the client is currently on. Okay, there is a complication that can occur in hemodialysis is arterial steal syndrome. And I have seen many important questions in Nclex exam that are on this arterial steal syndrome. So make sure to remember this. So this can happen in the client with an internal arteriovenous fistula. If the client have fistula, client can have this arterial steal syndrome because Too much blood is diverted to the vein. Sometimes it can happen when blood is going into the vein and the capacity of the blood is increased into the vein and gets compromised to go into the artery, and the arterial perfusion to the hand can be compromised, and the client can have a lot of symptoms, like client can have pain, client can have loss of sensation, weakness, ischemia, gangrene of the limbs. It can look like this. So make sure to remember this arterial steal syndrome. So there is one another complication that is also an important, as I already explained, to hold the antihypertensive drugs, because the client can have a risk of hypotension. It occurs because the rapid removal of vascular volume. The complication is hypotension, and I will show you the symptoms in a different slide. So this is just for you to remember what can happen if the client is getting hypotensive. Client can have lightheadedness, client can have nausea, vomiting, client can have seizure, or client can have vision changes or chest pain. This can occur because of hypertension. What the nurse have to do? What is the nurse's responsibility? So the usual treatment of hypertension is decreasing the volume of blood or the fluid being removed, infusion of 0.9% saline solution, and give Trendelberg position to the client. Why we are giving this position? So that blood can go from the body to the patient's brain, so the patient cannot be a brain dead if we are doing hemodialysis. Make sure to remember this. Okay, the last complication that the client can get with hemodialysis is disequilibrium syndrome. Solutes are removed from the blood faster than the CSF, which is why the fluid is pulled into the brain and the client can have cerebral edema. What are the symptoms for the client? Client can have headache, seizure, nausea, vomiting. The usual treatment for this syndrome is to slow the rate of infusion and notify the physician. And this is also an important complication to remember during hemodialysis. Okay, I'm gonna end this lecture by giving you some important Nclex steps. Make sure to write it down, guys. First one is never stop the dialysis infusion. Always slow the rate of infusion. If you are going to stop the dialysis while it's going on, the blood's gonna remain in those tubes and the client's gonna go to hypertension or anything can happen to the client. Make sure to not to stop, always slow the rate of infusion. Another thing is hemodialysis patient is at risk of blood-borne diseases because we are withdrawing the blood, inserting the blood, and doing a lot of things with the patient's blood. The client can have Hep B, Hep C, or HIV. Make sure to check for Bright and Thrill in the fistula, and it's also important to give 1 mg folic acid to the dialysis patient as per the physician's order. Last but not the least, if the patient is gaining weight during dialysis treatment, make sure to check the lung sounds to see if the patient is having pulmonary edema. Thank you and subscribe to my channel for further lectures like this.